Hi everyone, I'm Sakamoto. Today, I will explain the tips to select regenerative medicine. In regenerative medicine, a stem cell is collected from the patient's body and then cultured in a cell processing room. However, there are some ways to culture cells different in each cell processing room. What is important in stem cell culture is quality and quantity. In regenerative medicine, such as for knees and hip joints in Japan, 10 million stem cells are used on average. But depending on the cell processing room's technology, it may be increased up to 100 million. We are partnering with a cell processing room where up to 100 million stem cells can be cultured. These photos show actual results of stem cell injections. For each case, 10 million, 50 million, and 100 million stem cells were injected into knees, and formation of cartilages was monitored for 6 months. As shown in the red circle, cartilages were well formed when more stem cells were injected. More cartilages mean that the symptom is improved for a longer period of time. The second thing is quality of cells. Stem cell is actually living, so the ratio of living cells until injection is important. Stem cells cultured in a cell processing room are either frozen or chilled. When stem cells are frozen, half of them is said to be dead after thawing. In another case, more than 90% of cells are surviving. Clinical symptoms will completely differ depending on the preservation method. It is obvious that the treatment is more effective when lively stem cells are injected without freezing. Thus, there are different ways to culture stem cells in a cell processing room. The quality and quantity of cells are the key. As for quantity, more cells derive more effectiveness. As for quality, injecting lively cells without freezing derives more effectiveness. Being particular about the quality and quantity of cells, we are able to culture 25 million to 100 million cells. Also, we inject as much lively stem cells without freezing. As for regenerative medicine at our clinic, even those who require artificial joints for knees and hip joints, more than 90% of patients recover without surgical operations. Today, I introduced the quality and quantity of cells that are important in regenerative medicine. Thanks a lot for your attention.